If the liver, which performs many functions in the body, is damaged, various diseases can occur. However, the symptoms of these diseases do not show themselves initially. There are various indications. These are signs that there is a problem with the liver. It is very beneficial to consult a specialist when you see these signs. If you have any of the symptoms we will mention shortly, be sure to start treatment. If you're ready, let's get into the details now. First of all, let's answer the question, what is the function of the liver? The liver, located in the upper right side of the abdomen, is the largest organ in the body. The liver is also a gland. With the ability to expand and renew itself, the liver undertakes many important vital functions. The main functions of the liver, which is a very important organ, are as follows: synthesizing proteins, synthesizing and storing fats, storing and releasing carbohydrates, producing bile, producing urea, eliminating certain drugs and substances from the body, and synthesizing clotting factors. Now let's get to the answer to the question you're curious about. If there is a problem with our liver, the following symptoms may occur: constipation, diarrhea, and intestinal bleeding. You may experience intestinal bleeding due to constipation and diarrhea. If you are experiencing such a situation, there may be a problem with your liver. Abdominal pain. This pain usually occurs in the area where the liver is located, that is, in the upper right quarter of the chest cage. If the liver does not function properly, there may be disease or pain in this area. Increased itching of the skin. Your skin may become excessively sensitive to touch, itchy, and rashes may occur. While noticing that the veins of your body become more prominent, you may also see frequent bruises. If liver problems are properly diagnosed, skin sensitivity and itching will most likely not heal. Edema, especially the first symptoms seen in the feet and ankles. Edema can be caused by some of the reasons such as lymphatic disease, heart failure, and hormonal imbalance. You must consult a doctor to find out the real cause of the edema. Changes in the picture. If you feel cramps or pain in the lower part of your abdomen, the reason may be accumulation of fluid in the abdomen or liver damage. One of the earliest symptoms of liver damage is fluid accumulation in the abdominal cavity. Patients with such symptoms should definitely consult a doctor. Another symptom, jaundice. Yellowing of the eyes, fingertips, tongue, and skin are symptoms indicating jaundice. This disease generally occurs with the increase of bilirubin in the body tissues and circulation. If you have these symptoms, you may also be experiencing problems with your gallbladder or pancreas. Changes in stool color. Changes in stool color occur as a result of insufficient bile secretion by the liver. Instead of the normal and healthy brown color of stool, it can be seen as gray, clay-colored, or pale yellow. It is normal to observe changes in stool color from time to time, but if it happens frequently, it is advisable to consult a doctor. Another symptom is changes in urine color. Changes in urine color are a sign of kidney damage. Even if you drink enough water, if your urine still has a dark color close to orange, the potential reason for this is the decrease in bilirubin in the circulation. Digestive problems. One reason why the liver is such an important organ is its support in digesting food by producing bile. In case of liver failure, there is an increase in indigestion and diarrhea. Gallstones, constipation, abdominal bloating, intolerance to alcohol, intolerance to fatty foods, and sensitive bowel syndrome occur when bile is not produced properly. Another symptom is loss of appetite. Insufficient production of bile, which aids in the digestion of fats in meals, leads to loss of appetite. Failure to properly digest food can result in excessive weight loss and loss of appetite. If you have these symptoms for a long time, it is necessary to see a doctor. General weakness and fatigue, constantly feeling tired and weak, are some of the most well-known signs of liver damage. When the liver is unhealthy, the need for rest increases proportionately due to the body having to work harder than necessary. Nausea is another symptom. Vomiting and nausea are common features of liver problems. Depression, early pregnancy, motion sickness, food poisoning, and migraines can lead to these two conditions. Since the liver cannot rid the body of toxins, damage in this condition often causes frequent nausea. Now let's get to the answer to another important question: what causes liver failure? There are many known reasons for liver failure: viral hepatitis such as hepatitis A, B, C, Wilson's disease, acute fatty liver of pregnancy, galactosemia, metabolic diseases such as tyrosinemia, toxic drug-related causes, sepsis, multiple organ failures, wild mushrooms, alcoholic and non-alcoholic liver fatty diseases. Liver failure can also be seen as a reason unknown. Liver failure is a disease that can happen to anyone. It is necessary to take some precautions to protect against the disease. So what are they? Hepatitis A and B vaccines, which are compulsory vaccines to be administered during primary and secondary education periods, are mandatory vaccines that carry the risk of causing liver failure in With the regulation made in 2020, these vaccines have now started to be administered in family medicine units. The presence of the hepatitis virus is also an important risk factor for the development of liver cancer. When avoiding toxic drug-induced liver failure, especially when using medications containing acetaminophen, it is essential to strictly adhere to the recommended doses of the drug. Long-term alcohol use can lead to liver failure. Since it is difficult to distinguish between the toxic type and the safe type of wild mushrooms, one should stay away from wild mushrooms. Obesity can lead to liver failure in later stages of non-alcoholic liver fatty disease, as it is a trigger for many diseases. Therefore, maintaining a healthy diet and weight is important. So, who gets liver cancer? Liver tumors that develop in patients with hepatitis B, hepatitis C, or cirrhosis usually do not show symptoms in the early stages. Hepatitis B and hepatitis C are among the most common diseases in our country. The presence of the hepatitis virus is also an important risk factor for the development of liver cancer. The average age of diagnosis of liver cancer is 62. More than 90% of patients diagnosed with liver cancer are over 45 years old, while less than 3% are between 35 to 44 years old, and less than 3% are younger than 35 years old. We're ending our video here. Please remember to like and share our video and subscribe to our channel by commenting, so others can benefit as well. We wish you all a healthy and happy life. Goodbye.